Imagine you have a scrape that doesn't heal and slowly transforms into a painful wound. For millions with diabetes, this scenario is a common fear known as a foot ulcer. These sores can lead to severe consequences, but with the busy world of healthcare, monitoring these wounds is challenging. That's where the breakthrough study we're discussing steps in, aiming to change the game on how these wounds are handled. Foot ulcers are more than just stubborn sores. They're a silent epidemic, often leading to alarming endings like amputations, or even fatalities if not properly cared for. Usually, doctors use their best judgment to measure and treat these wounds, but this method isn't always as accurate as we'd hope. Picture trying to guess the size of a stain on a carpet by just looking at it. There's a lot of room for error. To help, the research team developed something called AFSegGAN, a smart system that uses pictures of a wound to analyze its size, shape, and healing process. It's like having a super smart computer that can look at a wound photo and provide all the precise measurement details, saving nurses and doctors a ton of time. AFSegGAN, the star of our show, is a system made up of several parts. Imagine you have an app on your phone that takes a picture of a wound. This image gets sent to the cloud, a secure online storage space, where all the magic happens. The AFSegGAN works like an artist and a critic. One part creates a detailed mask over the wound in the picture, while the other critiques if the mask looks like the real deal. Together, they refine the wound's image so that doctors can get a very accurate idea of its size and shape without ever touching it. This process of fine-tuning the wound image is much like cooking a new recipe. You try, make mistakes, adjust, and try again until you get it just right. The system keeps improving with each try, learning how to handle even the trickiest of images. After AFSegGAN does its job, another system called the Morphological Feature Estimation Module steps in. This part is like the cleanup crew that smoothens out the rough edges, making sure that the final image is as close to perfect as possible. It ensures that small distractors are removed, and the wound's size and shape are clearly defined for easy dressing and treatment. The results? AFSegGAN outdoes humans and other current methods, proving itself to be a reliable and efficient system. Even when dealing with poor quality images, where a human eye might falter, AFSegGAN shines, capturing details accurately. Nothing is perfect, and AFSegGAN is no exception. Sometimes the system might interpret non-wound areas as part of the wound, especially when the image quality isn't the best. But just like a student learning from mistakes, AFSegGAN has room for growth and improvement. AFSegGAN has the potential to transform wound care for millions. It offers a glimpse into a future where technology and healthcare merge seamlessly, ensuring that those silent wounds don't go unnoticed, but instead find their way to healing more efficiently than ever before.